Yes. Good morning, everyone. Today's topic is on occupational health. So I'm Dr. Arul, Assistant Professor from Department of Community Medicine, Science, Pondicherry. So let us go to the topic. So the overview of my presentation will be, I would start with the introduction, the classification of occupational diseases, pneumoconiosis, lead poisoning, occupational cancers, occupational dermatitis, radiation hazards, hazards due to industrialization, accidents in the industries, and finally the references. So what is basically the occupational health? So occupational health, the definition of occupational health is given by the ILO and WHO. ILO is International Labour Organization and World Health Organization. It is nothing but promotion and maintenance of the highest degree of physical, mental, and social well-being of the workers in all the occupations, and prevention among the workers of departures of the health or deviations of the health which are caused by their working conditions, and protection of workers in their employment from risk resulting from factors which are adverse to their health, and placing and maintenance of the workers in an occupational environment adapted to his physiological and psychological equipment. So these are basically some of the definitions or concept of occupational health which are given by ILO and WHO. So basically all these meanings, all these definitions, they lead to a common concept, that is adaptation of the work to the man and of each man to his job. That's it. So before going to the topic occupational health, let us see what is meant by hazard and what is meant by a workplace. Hazard is something that can cause harm if it is not controlled. And what is a workplace then? Workplace is a setting in which many people spend the largest proportion of their time. So you should know the difference between this hazard and the workplace. And also there are some differences between the work-related disease and occupational disease. Both are not the same. Okay? So work-related disease occurs largely in the community, whereas occupational disease occurs mainly among the working population group. Okay? And work-related disease are usually multifactorial in origin. So it has many causes, whereas occupational disease have some specific causes. For example, bagasosis is caused by sugarcane dust. Brucellosis is caused by cotton dust. So these are some specific causes for the occupational diseases. Fine. And exposure at workplace may be a factor in the work-related disease, whereas exposure at workplace should be an essential factor in an occupational disease. And work-related disease may be notifiable and compensable or may not also, whereas your occupational disease are notifiable and all the diseases are compensable. Okay. So let us see the hazards which can occur in an occupation. Okay. So we classify the hazard into physical hazards, chemical hazards, biological hazards, mechanical hazards, and psychological hazards. So what are the physical hazards? So physical hazards can be heat, cold, temperature, vibrations, radiations, ionizing radiations, etc. Right? So let us see the effects of the heat. The heat can be, can produce a direct effect or an indirect effect. Okay? The direct effects are burns, heat exhaustion, heat stroke, heat cramps. Whereas the indirectly, the heat also decreases the efficiency of the work. It increases the fatigability and it also increases the rate of the accident in the industry. So who are all at risk for the heat exposure? Okay. So these are the groups of people like agricultural workers, firefighters, especially civil engineers, factory workers, street sweepers, athletes, okay, soldiers, electrical engineers, traffic policemen, welders, oil refinery workers, etc., etc. So these are some of the groups of people wherein their work job is related to the heat exposure. So they are at risk to get the hazards or the diseases which are related to the heat. Next is cold. So because of cold exposure, the people may get chilblains, erythrocyanosis, immersion food, frostbite as a result of cutaneous vasoconstriction and general hypothermia. So who are all at risk for the development of hazards because of the cold. Okay? Fishermen, because they go for fishing in the deep sea, right? So they are exposed to cold. And people, those who are working in the frozen food section, they are exposed to cold at very low degrees of temperature. And road construction workers, market vendors, soldiers during the war. So these are the groups of people who are exposed to cold because of their work related exposure. Fine. Then, what is the effect of light? Light, okay. So light effect, both on either side of the spectrum, we have effects. Either it can be effect due to poor illumination or effect due to excessive brightness or glare. Okay. So what happens because of poor illumination? Okay. So it has acute effects and chronic effects. So acutely it causes eye strain, headache, pain over the eyes, lacrimation, that is increased lacrimations can occur, congestion around the cornea, and eye fatigue also can occur. So chronically exposed to poor illumination, it can lead to a nystagmus condition. So that is called as minus nystagmus because it occurs most frequently those who are working in the mine industries. Okay. So excessive brightness, what happens if there is a glare of light? People who are working in an excessive brightness environment. So those people can get dullling of vision, visual fatigue, annoyance because of the light, and discomfort. Okay. So these are the effects of light. Then comes the noise. Okay. So noise exposure can lead to auditory effects and non-auditory effects. So what happens if there is exposure of excessive noise to the ears? It can lead to temporary or permanent hearing loss. So either it can be temporary or permanent hearing loss. And what happens to the non-auditory effects? So it leads to nervousness, fatigability, and there will be interference in the communication because of excessive noise, right? So between two people, there will be interference of communication. And also there is decreased efficiency of the work, and it also leads to annoyance. So these are some of the effects of noise exposure. So who are all at risk for the noise exposure? Especially the farmers, civil engineers, okay, construction workers, because they might be using drilling equipments and drillers, all those equipments they be using, right? They are exposed to noise hazards. And factory workers, those are involved in mining works, musicians and music teachers, airline workers, police people, soldiers and pilots, because these are the group of people who are exposed to high frequency of noise in their day-to-day life. So they are at risk of developing the effects due to the noise. Fine. So then we'll see about the vibration. Okay. So vibration, especially those who are using the drilling equipments, okay, and hammers. So those people are at exposed risk or exposed effect due to the vibrations. Okay. So what happens if there is vibration, excessive vibration? It leads to spasm of the blood vessels over the hands, okay, or the fingers. So that is vasoconstriction. So what happens if there is vasoconstriction? The blood supply will be decreased to the fingers, right? So because of this decreased blood supply, it leads to white fingers. Okay, so condition called as white fingers. So who are all at risk to the who are all at risk workers for the effect of vibrations? So those are hammer drill operators, chainsaw operators, bulldozer drivers, loader drivers, people who are working with pumps, compressors, and generators are also exposed to vibration. Next is ultraviolet radiations. Okay, so ultraviolet radiations, people who are working in the welding processes, are the arc and other electric welding processes, they are exposed to this ultraviolet radiation or UV radiation. Okay, so sometimes it causes severe conjunctivitis. There is inflammation of the conjunctiva, and keratitis, inflammation of the cornea. Okay, because of this radiation exposure. Sometimes it is also called as welder's flash. Even people can get the cataract. Okay, those who are working in welding industries, they can get a cataract. That is called as welder's cataract as well. So if you have seen, that is why they will use some goggles like this in order to protect the UV rays which are disseminating from the welding equipments. Right? So next comes the ionizing radiations. Ionizing radiations, the effects of ionizing radiations are, it can lead to genetic changes, malformations in the fetus, cancers, leukemias, ulcerations over the skin or the mucous membranes, and depilation. Okay, that is loss of hair. It can also lead to sterility. In exposure, severe exposure can lead to sterility, and in extreme cases, it leads to death. Fine. So far we have seen the physical level. So what all we saw about the heat, we saw about the cold, we saw about the light, we saw about the radiation, we saw about the vibration. Okay, so these are some of the UV rays exposure, ionizing radiation exposure. So these are the effects and the occupational groups we saw. Okay, so now we move on to the chemical hazards. Okay, so chemicals as such, it can have its effects in by means of three modes of action. One is it can locally act. If it is spilled over the body surface, it is locally act and produces its effect, that is called as local action. Apart from local action, it also has its effects when it is inhaled or it is ingested. So what happens locally? Okay, local action is mainly caused by the irritants and sensitizers. Okay, so it leads to dermatitis, the eczema, ulcers, and sometimes cancer by chronic irritant action. So inhalation. Okay, by inhaling the through the nose, and the particles get deposited in the lungs or in the trachea or in the tracheobronchial tree, and it leads to effects. Okay, so we have dust which can be inhaled and gases which can also be inhaled. Okay, so what are the dust? Dust can be classified as inorganic, organic dust, soluble dust, insoluble dust. The gases, again, it can be classified as simple gases, asphyxiating gases, and anesthetic gases. And finally, we have the metals and their compounds. So let's see each of these. So what all can be ingested? Ingested is through the mouth, through the oral. Okay. So these compounds like lead, mercury, arsenic, zinc, chromium, cadmium, phosphorus, antimony, beryllium, cobalt, manganese, and etc. So many compounds are there which can be ingested. So ingestion can occur because of accidental or wanted also, deliberate ingestion also. Accident ingestion occurs by means of these compounds which are contaminated in water or in the food substances or in the vegetables or in the fruits because of insecticides and pesticides, or deliberately it can occur because of poisoning, because of work pressure, because of emotional disturbances. It can occur because of poisoning. So these are the ways that ingestion can occur. So next is the hazard due to the biological agents. So biological agents, who are all the at-risk people for getting the biological hazards or healthcare workers? Okay, so we the healthcare workers are more prone to get certain virus infections and bacterial infections like hepatitis B and C virus, HIV infection, and TB infections. Okay. Next is people who are working in agricultural industries and animal husbandries. They are prone to get brucellosis, leptospirosis, anthrax, hydatidosis, tetanus, encephalitis, fungal infections, and schistosomiasis. Then what are the mechanical hazards which can occur? About 10% of the accidents in industries are said to be due to mechanical causes. So people who are agricultural workers, construction workers, transport workers, and business establishment workers are prone to get mechanical injuries. And now, last but not the least, people also, most of the people will get psychological injuries, okay, because of frustration, or either it can be lack of job satisfaction, job insecurity, poor human relationships in the workplace, emotional tension or work pressure. So all of these leads to emotional stress. Okay, it can lead to many psychiatric illnesses or physical illnesses or poor sleep. Okay, so these are some of the effects of psychological hazards. Okay. It can lead to psychological and behavioral changes or a psychosomatic problem. Okay, psychosomatic, it is physical problems. So far we have seen the various hazards. So what all we saw about the physical hazards, the chemical hazards, biological hazards, mechanical hazards, and psychological hazards, right? Now we will classify, we will study the occupational diseases. So because of the factors, we get some diseases, okay? So we are going to classify the occupational diseases based on the physical agents now. Okay. So what happens? What are the diseases which can occur because of heat exposure? So we get heat hyperpyrexia, that is increased body temperature, heat exhaustion, heat syndrome. So people who are working in desert industries, okay, I mean desert, those are have their job in desert areas. They are prone to get heat hyperpyrexia, heat exhaustion, or heat syndrome. Okay. Also, they can get burns and local effects such as prickly heat. Fine. So what happens because of cold exposure? People can get trench foot, frostbite, and chilblains. We saw already, like you have seen the picture of it. And because of light, people can get minus nystagmus, occupational cataract. And what happens because of pressure exposure? Okay, because of long-standing pressure, like Caison's disease, those who are deep sea divers. Okay, these people can get Caison's disease. Or mountain climbers, they can get mountain sickness. Sometimes deep sea divers can also get air embolism. Okay, and blast. These are some of the effects of the pressure. Noise exposure can lead to occupational deafness, and also it has a non-auditory effect like emotional stress, impairment in the communication, etc. And radiation, it can lead to cancer, leukemia, aplastic anemia, pancytopenia, etc. Mechanical agents can cause injuries and accidents, and electricity leads to burns and sometimes death also. So chemical agents are classified as gases, dust, metals in their components, chemicals and solvents. So gases like carbon monoxide, sulfur dioxide, so carbon dioxide, nitrogen gas, hydrogen sulfide gas. Okay, these are some of the gases which can produce this effect. Okay, and it can cause even poisoning, even illnesses, etc. Dust, those diseases which are occurring because of dust, we call it as a pneumoconiosis. Okay, so pneumoconiosis are again classified as inorganic dust and organic dust. So inorganic dust, we have coal dust, silica, asbestosis, and iron. So coal dust exposure leads to anthracosis, a condition called as anthracosis. Silica leads to silicosis. Asbestos exposure can lead to asbestosis or sometimes mesothelioma and lung cancers. Okay. Iron exposure can lead to siderosis. So these are the diseases which affects mainly the lungs. Okay, and impairs the vital capacity, and finally it leads to fibrosis and death. Next is organic dust exposure. Okay. These are vegetable dust exposure like cane fiber, cotton dust, tobacco, hay or grain dust. So sugarcane fiber, it leads to bagasosis. And cotton dust fibers, it leads to bizzinosis. Tobacco, it leads to tobaccosis. Hay or grain dust, it leads to farmer's slump. Okay. Metals, we have some metals like and their compounds can be also the source for occupational exposure like lead, mercury, cadmium, manganese, beryllium, arsenic, and chromium. And as per se, the chemicals as such, acids or alkalis or the pesticides can also cause occupational hazards. And various solvents are used in industries to melt the compounds, to melt the solids, to melt the various metals. Okay? So like carbon bisulfite, benzene, trichloroethylene, chloroforms. So these are also some of the agents which can lead to poisoning or which leads to chronic effects. So other agents are biological agents, occupational cancers. Those most important occupational cancers. It can lead to skin cancer, lung cancer, bladder cancer, and leukemia. Okay. So occupational dermatosis. Next is occupational dermatosis. It can lead to dermatitis and eczema. Okay. And because of the work pressure and workplace environment, people can also get psychological illnesses like industrial neurosis, hypertension, and sometimes verticulture also can develop. So now we will see what is pneumoconiosis. I already told you that pneumoconiosis are basically the chemicals. Okay, they are basically the dust which are inhaled and they are deposited in the lungs and they impair the vital capacity of the lungs and it leads to fibrosis. Okay, so that is the basic physiology or pathology of pneumoconiosis. So pneumos means it is lungs, okay? And conios means basically they are dust. Okay, so these are group of diseases occurring out of the specific occupation because of inhalation of the dust, okay, which are there in the occupation environment over a longer period of time. So these are also known as dust diseases. Okay. So some of the factors which leads to pneumoconiosis are the concentration of the dust in the air, the composition of the dust, the size of the dust particles also matters. Okay, because smaller size particles can be easily inhaled and they deposit in the alveoli level. Okay, and they are the one which causes massive fibrosis. The duration of exposure and the individual susceptibility. So next is silicosis. So silicosis, mainly industries like mining industries and pottery industries. So these are the two most common industries. People who are working there are exposed to the silica dust and they are prone to get silicosis. Apart from these two industries, sandblasting industries, metal grinding industries, building and construction works, rock mining, iron and steel industries are also prone to get silicosis. Okay, so this is the commonest occupational disease, and it is also a major occupational disease and most serious occupational disease. Okay, and mainly it occurs because of inhalation of dust, which contains free silica, silicon dioxide, or wax. First, it was reported in in India, that's Mysore, in Kola gold mines there in 1947. So because of this, it is also since it occurs because of sand. Those are working in sand grinding or metal grinding. It is also called as grinder's disease or potter's rot. So incubation period, okay, the time into the onset of disease and occurrence of signs and symptoms may be from few months to few years. So it is a very long period. Okay. So remember this incubation period is very long. So you can employ some screening tests in order to diagnose this condition earlier and provide necessary action for the particular individual or particular industry or company. Okay. So people usually present with irritant cough, dyspnea on exertion, loss of weight will be there, emphysema can be seen, and chest pain. Sometimes, this silicosis can be associated with tuberculosis infection. So we call this as a silicotuberculosis. When you take X-ray for this patient, you can see a snowstorm appearance or ball of wool appearance in the apex of it. So you can see the snowstorm appearance. Okay, and in the next X-ray, you can see the ball of wool appearance. Fine. So how to treat? Is there any treatment for silicosis? No, there is no treatment for silicosis. So what is the prevention? How can we prevent this? So mainly is rigorous dust control measures by means of substitution with other instead of silica you can use some other compounds, a complete enclosure of the working space, isolation, hydroblasting techniques, good housekeeping practices, and use of masks and goggles, aprons can also protect silicosis. Okay. And regular physical examination of workers by periodical examination or pre-placement examination can be done before employing the worker in the industries. Next is asbestosis. Okay. Asbestosis occurs because of inhalation of the asbestos dust over a long period of time. So it is a commercial name. Asbestos is a commercial name given to fibrous mineral silicate. Okay. It is nothing but silica combined with oxygen and some other elements like calcium, magnesium, iron, sodium, and aluminum. Okay. People who are working in industries like asbestos cement factory, fireproof textiles, roof tilting, brake lining, etc., are all people who are exposed to these asbestos dust and they can develop asbestosis disease. So how can we diagnose this? If you collect sputum from this patient, you can demonstrate something called asbestos motifs. Okay? These are characteristic feature of asbestosis. An X-ray chest shows ground glass appearance. X-ray shows ground glass appearance. So how can we prevent asbestosis? Use of a safer type of asbestos. Instead of the unsafe type, we can use some safer variants of asbestos like risolite and amosite. These compounds are safer variants. And substitution of other insulating materials like glass fibers, mineral wool, calcium silicate, plastic foams, etc. And most importantly, dust control measures like rigorous dust control measures should be taken care of. Periodic examination of workers is able to detect the disease at an earlier stage and we can initiate appropriate control measures. And most importantly, the workers should be advised to use the personal protective measures and should be taken care of. And health educating the workers can also prevent asbestosis. Next is Anthroposis. Anthroposis means coal. Okay? People who are working in coal industries, they are prone to get this pneumoconiosis, which is called as coal workers pneumoconiosis or miners' lab. Okay? Due to inhalation of this coal dust over a period of time, this coal gets deposited in the lungs, and it can lead to simple pneumoconiosis, or it can lead to progressive fibrosis also. So in this picture, if you see, there are black color particles on the left side of the diagram, right? So those are nothing but anthroposis. Those occurs because of coal exposure. So next is how to diagnose anthroposis. Anthroposis, if you take X-ray for these patients, there will be black, it is called as black lung. We get multiple nodular densities. Get multiple nodular densities in the X-rays. So next, so far we have seen the inorganic dust. Now we are going to see the organic dust. Organic dust are basically which are occurring from the vegetable sources, from plant sources. Okay? So this is due to inhalation of cotton dust over a long period of time. Okay. It is also called as mundane field. It is most common in textile industries. In India, nearly 35% of the workers are working in textile industries. So of which the early incidence also, it comes around 7 to 8% of the workers are prone to get bucinosis, are getting bucinosis. So this particular organism, Aerobacter troiaceae, which contaminates the cotton fibers. So what happens is, if you inhale the cotton fibers, this organism also enters into the lungs and it initiates the pathological process. Right. So this is all about the bucinosis. So next come the beggar sources. Baggage means sugar cane, okay, sugar cane dust, that molasses, sugar cane dust. So it occurs because of inhalation of the sugar cane dust. So what happens is, if the baggage is left open, it leads to contamination of fungi, growth of fungi, which is called as thermoactinomyces sacchari. Thermoactinomyces sacchari. Okay. So people who are working in sugar factories or paper industries, cardboard industries, and rayon factories are prone to get bagasosis. So in India, first this case was reported in Kolkata by Ganguly and Park in a cardboard factory industry in the year 1955. So on X-ray, if you take X-ray, lung fields shows mottling appearance, and dust control measures, personal protective measures, and baggage control measures can prevent this occurrence of this disease. So next, organic dust exposure is farmers. Okay, so farmers are prone to inhale this hay, moldy hay or grain dust, wherein another thermophilic actinomycetes, this species, Micropolyspora fili, is the major cause for contamination of this moldy hay. So when inhaled, it can lead to features like bronchial asthma, pulmonary fibrosis, allergic bronchitis, and sometimes cor pulmonale can also occur. Okay. So when you take X-ray for these patients, there will be fine nodular opacities in the X-rays. That is all about the dust. Okay. So we saw about inorganic dust and organic dust. So under the inorganic dust, we saw about pneumoconiosis, silicosis, asbestosis, anthroposis, right? And under the organic dust, we saw about what we saw, bucinosis, bagasosis, farmer's thumb. So these are the things we saw under the pneumoconiosis. Okay. So now we'll move on to metals and their exposures. Okay. So one of the important metals, which is the most toxic metal poisoning, is the lead poisoning. Okay. So lead poisoning is also called as Saturnism, plumbism, or painter's coding. So lead components, all the lead components are not toxic. So some major toxic components are these: lead arsenate, lead carbonate, lead oxide. Okay. Whereas this lead sulfide is the least toxic lead component. Okay. The sources of lead, okay, which are the industries or which are the factories which are responsible for lead poisoning, are those are involved in mining industries, batteries, okay, glass manufacturing industries, printing and pottery industries, rubber industries, ship industries, plumbing works. Okay, so these are the groups of people who are exposed to constant lead. Okay, so they are prone to get lead poisoning. The sources of lead can be divided into non-occupational and So occupational and non-occupational. Non-occupational sources of lead may be due to usage of gas or that is leaded through drinking water also can be contaminated with lead. Fruits and vegetables wherein the insecticides or pesticides are sprayed, if it is consumed without proper washing, can also lead to lead poisoning. And children, especially during the pica, okay, this is the condition where children will eat the sand or the ashes because of anemia and some other disorders. Some of the behavioral disorders also leads to pica. Okay, in that case, they are exposed to lead poisoning. And children, they also chew these toys which are coated with lead or the lead paint on windows. If they are chewing, it also leads to lead poisoning. And if biting lead pencils also leads to lead poisoning. These are some of the non-occupational causes of lead poisoning. So, what are the clinical features of lead poisoning? Okay. Inorganic lead, it leads to anemia, blue lines on the gums, which is called as Bartonian lines, colicky abdominal pain, it leads to diarrhea, encephalopathy, fatigue, growth failure among the children, headache, irritability, joint pains, kidney damage, lassitude, mental retardation, nausea, oliguria. Okay, it also leads to paralysis sometimes, there is wrist drop can occur. It leads to sterility, tremors, vertigo, and weakness. Whereas the organic lead poisoning can lead to insomnia, mental confusion, delirium, coma, and death. So, how to diagnose lead poisoning? Basically, to measure the level of lead in the blood as well as in the urine. Okay. So, normal cutoff is given here. If it is more than 70 microgram per 100 ml in the blood, it is a dangerous. It can lead to lead poisoning. And if it is more than 0.8 milligram per liter in the urine, it is suggestive of lead poisoning. Apart from the level of lead in the blood as well as in the urine, we also have two other tests that is called as urinary aminobutyric acid (ALA) level. If it is 60 milligram per liter, it is dangerous level. And urinary coproporphyrin. Urinary coproporphyrin. If it is more than 250 microgram per liter, it is at the dangerous cutoff level. So, if you are diagnosing lead poisoning, you should measure all these parameters. And again, in the lead poisoning case, if you take the blood of the patient and you examine the pressures, you can be able to see microcytic hypochromic anemia and basophilic stiffening of the RBCs. This basophilic stiffening of the RBC is the characteristic feature of lead poisoning. So, how to manage or how to prevent lead poisoning? Okay. So, prevention of further exposure of lead, you can change the job of the particular patient or the particular person who are working with. Okay. And acute lead poisoning, you can manage with saline purge, or you can use some chelating agents like calcium EDTA and D-penicillin. So, how to prevent? How to prevent and control lead poisoning? By means of pre-placement examination. So, before placing the person in the job, you do some examination and you're placing that person into the job. Okay, that is called as pre-placement examination. Next is periodical examination, which means that after the person is employed in the job, you do some medical examination at various frequencies or various intervals of time. That is called as periodical examination. Apart from this, some other measures like substitution, isolation, local ventilation, good housekeeping levels, personal protective equipment is one important thing which can prevent lead poisoning, and use of unleaded petrol and heat education can all prevent the lead poisoning. Next, so far we have seen the pneumoconiosis and the metals and their compounds exposure like lead poisoning. Now we will see about occupational cancers. Okay, occupational cancers are also called as industrial cancers. The common cancers are, skin cancers, lung cancer, bladder cancers, and leukemia. So let us see the carcinogens involved in each of these cancers. So since skin cancer, 75% of the occupational cancers are basically the skin cancers. So these carcinogens like anthracene, the coal tar, soot, oils and dyes, acids, UV rays, and X-rays are all the agents which can cause skin cancer. So people who are working in gas workers, coke, oven workers, dye stuff workers, road makers, oil refiners, farmers, and radiological departments, who are working in radiological departments are also prone to get skin cancers. Okay. So who are can get lung cancer? Okay. People who are working in asbestos factories, uranium miners, nickel refineries, gas industries, and tobacco industries are prone to get lung cancer. Okay. So carcinogens involved are arsenic, asbestos, tobacco, coal tar, nickel, etc. And people who are working in dyeing industries, rubber industries, gas industries, and electrical cable industries are prone to get bladder cancer. Okay. And carcinogens which are involved in the causation of bladder cancers are aromatic amines, beta naphthylamines, benzidines, paraminodiphenyl compounds, oramine and magenta. Okay. So people who are working there are prone to get bladder cancer. So next is leukemia. So carcinogens involved are benzoates, the X-rays, radioactive substances are all positive factors for development of leukemia. So people who are working in atomic research stations or radiology departments are going to get this leukemias. So we have seen the occupational cancers. So next, the most common thing which we can see in the work environment is the occupational dermatitis. Okay, this is most common thing. Nearly 40 to 70% of the people who are working are prone to get occupational dermatitis. So agents can be a primary irritant or the sensitizing substances. So physical agents like heat, cold, moisture, friction, pressure, and X-rays can lead to occupational dermatitis. Whereas some of the chemicals like acids, alkalis, the oils, the dyes we use, the solvents, also working in road making tar, they also produce occupational dermatitis. Okay. And biologically, all the organisms are prone to provoke the occupational dermatitis. And plant products like leaves, fruits, and flowers, vegetables, and plants, the extracts of the plants, the scents of the plants are also prone to, produce this occupational dermatitis. Okay. So these are some of the pictures. You can see some of the blisters here, some of the chronic, dermatitis. Okay, these are some of the blisters which occurs because of this occupational exposure. Okay, these are also some of the pictures of occupational dermatitis. So what next is radiation. So what can occur because of this, radiation? Who are all at risk of radiation exposure? Radiologists, X-ray technicians, persons who are working in the mining industries or atomic research plants, okay, aircraft workers, luminous tile painters, okay, military personnel, or radioactive paints manufacturing companies. So persons who are working there are prone to exposed to radiation. Okay. If you have seen radiology department, people who are working there will be as a badger. Okay. This is to measure the amount of radiation they are exposed daily. Okay. This is a badge which shows the amount of radiation that is exposed daily. So what are the effects of radiation? It can lead to acute burns, dermatitis, leukemias, genetic effects, sometimes malignancies, and sometimes lung cancer also can happen. So next we will see about industrialization. So what are the problems can occur because of industrialization? So general problems are housing problems can occur, overcrowding can occur. Because of overcrowding, many diseases can be transmitted. Water pollution, air pollution, that could be problem in sewage disposal. Improper sewage disposal also leads to spread of many diseases, right? Waterborne diseases, fecal-borne diseases can occur, and communicable diseases like tuberculosis, venereal diseases like STDs, HIV/AIDS, food and waterborne diseases, vector-borne diseases can occur because of industrialization. Okay. So next is because of improper food sanitation practices, it can lead to typhoid, viral hepatitis, anemia, etc. People who are working in industrialized countries are prone to get mental illnesses, psychoneurosis, behavioral disorders, and juvenile delinquencies are very common in industrialized nations. Accidents can also occur because of congestion, increased vehicular traffic, and increased tempo of life can lead to accidents. social problems in that because of alcoholism, drug addiction, gambling, prostitution, divorce, and crime rates increase because of industrialization. Next is accidents in the industry. So accidents are do occur in an industrial environment, right? So it is most commonly seen in coal industries or construction industries. Those are working in quarries because of landslides, because of mechanical injuries, they get accidents. So accidents are so common in working industry. Okay. So in India, nearly 3 million man days yearly accidents occur. And accident rate in India is nearly 0.14 per thousand workers. Each year, they are getting the accident. Okay. And nearly 92% of all these accidents leads to temporary disablement, whereas 5 to 6% of this leads to permanent disablement. Okay. Fatal accidents are nearly 2 to 3% of the accidents are fatal, which leads to death. So the factors which leads to accidents in industries are the physical factor, there's impaired hearing, improper vision can lead to accidents. And physiological problems like because of age, because of old age, because of poor experience, because of increased duration of work can lead to accident progress. And psychologically, because of carelessness, overconfidence, lack of concentration in their work, emotional stress can lead to accidents. And environmental factors like fog, poor illumination, increased humidity, noise, unsafe emissions can lead to accidents. So that is all about the occupational health. So we have seen in today's class regarding the various hazards. Okay, what are the physical hazards, what are the chemical hazards, what are the biological hazards, mechanical hazards, and psychological hazards which can occur in an occupational environment. And then we saw about the classification of occupational diseases, right? So, and then we saw about the various pneumoconiosis, which can occur because of inorganic dust or organic dust. Inorganic dust, what we saw about pneumoconiosis, anthracosis, asbestosis, etc. Right? And because of organic dust, we saw about we can get cyanosis, bagazosis, pharmacy. Then we saw about occupational cancers like skin cancer, lung cancer, bladder cancer, leukemias, etc. And then we saw about occupational injuries and occupational accidents. And we saw about the problems of industrialization. That's all. So any doubts, please do ask questions. Thank you. So these are the references.